Hello, this is Lawrence Holve from Holve Healthcare, and today I'm going to give a very quick talk on the sacroiliac joint. So first of all, to show you the region where the sacroiliac joint is, here's a spine. These are the lumbar joints, all 5 of them. 1, 2, 3, 4, 5. Here you've got the sacrum, this triangular shaped bone, and this is the pelvis. This is the ilium. So what happened? This is where the actual joint lies. So you can see it's quite a big joint, and it's held together by very tough ligaments. Now, there is some controversy about the sacroiliac joint because as you get older, it naturally becomes much stiffer, it fibroses, so there's not much movement if there is movement at all. However, a lot of people complain of pain either in their lower back, but very often down here, and that is exactly the region of the sacroiliac joint. So what potentially happens is that people with a lumbar joint problem or a lumbar spine problem is that pain refers into that area. Notwithstanding that, the sacroiliac joint by itself can, on many occasions, cause pain. Particularly common in women because the sacroiliac joint opens up to allow passage of a baby. So when a woman is pregnant, the sacroiliac joint naturally starts to open up, and this later on can cause problems. Men as well, they can also get problems around there because some are a bit more mobile than others, and it can just start to irritate in that area. Sacroiliac joint pain, shall we call it, it causes quite a lot of discomfort, and people often come to me for treatment. So you may ask, what are the treatment options? Well, because it's such a big joint, it has to be worked on quite intensely. So osteopathy is obviously one of the foremost therapies that you can use to help people recover from sacroiliac joint pain. In terms of manipulation, very difficult to manipulate because of these very strong ligaments. So what tends to happen is that very often there's some stretching and some soft tissue work done around the ligament area, which helps stimulate blood flow and reduce pain. The other options are that if sacroiliac joint pain persists, and sometimes it does because it's such a strong joint, very occasionally people might have to be referred for injection just to subdue any inflammation. There are a few conditions that can cause a condition called sacroiliitis, which is inflammation of this joint, such as ankylosing spondylitis. Luckily quite rare, but it's always a sign that this is an inflammatory condition and this needs other types of treatment. And it's up to the person who's seeing you to establish whether this is going on. So in summary, sacroiliac joint pain is quite common. Sometimes it's referred from the lumbar spine. Occasionally it is straight from that sacroiliac joint, which needs attending, and osteopathy is very useful. And I haven't mentioned the other big modality that can be used is acupuncture, because obviously you can get needles around that area which help not only block pain but can stimulate blood flow and just reduces pain overall. I tend to get very satisfactory results with treatment, so if you have any problems in that area, give me a call anytime and I'd be pleased to discuss it and arrange treatment so that you can be helped in the future. Thanks very much for watching, and until the next episode. Bye-bye.